Tracheostomy ties, or trach ties, are the Velcro securement device used to secure tracheostomies at Trinity Health, Livonia. They are a disposable Velcro strap that secures the tracheostomy to the patient's neck, and on occasion, these trach ties need to be replaced. This video will demonstrate a two-person technique for replacing trach ties. If the patient has a tracheostomy placed at Trinity Health, Livonia, it will be a Shiley Flex. If a patient comes into the hospital with an existing trach that was placed elsewhere, it may be a different make and/or model, but tracheostomies all have the same basic functions, and they will also utilize the same trach ties for securement. Around the cannula of the tracheostomy is the flange. The flange on the Shiley Flex is made of a very pliable material, which will make applying trach ties easier. On either side of the flange is an opening where the trach ties will attach. When you connect the trach ties, insert from the back of the flange and make sure the Velcro is facing out. You will pull the tie through the opening and attach the Velcro to the back of the tie. When should trach ties be changed? There is no standard timeline for applying new trach ties, but you should be assessing the condition of your patient's trach ties regularly. This is easily done while repositioning the patient. If trach ties are wet or soiled, they should be replaced. If left in place, these soiled trach ties could cause skin breakdown and infection. Depending on the patient, they may need multiple changes in a day, or they may not need to change their ties during an entire admission. Diligent assessment is the key to keeping the patient safe and healthy. Trach ties can be replaced by either the respiratory therapist or the registered nurse. Before you begin, you will need to gather some supplies. You will need the standard PPE for caring for trach patients: clean gloves, a mask, and eye protection. You will also need new trach ties and split gauze, which can both be found in the pod room. Only use packaged split gauze. Never cut whole gauze 4x4s to create split gauze. It leaves the edges frayed, and the loose ends can lead to infection. Always use caution when exchanging trach ties. There is a risk for decannulation, or the accidental removal of the tracheostomy, if you don't secure the trach during this process. For that reason, it is best to utilize a two-person technique while replacing ties. One person will stand on either side of the bed. The trach should be securely held down by applying pressure to both sides of the flange while the trach ties are not secured. With a two-person technique, 2 hands should be pressing on the flange while 2 hands are manipulating the trach ties. With your supplies gathered and an assistant present, you can begin the process of replacing the trach ties. First, loosen the trach collar enough to allow your hand space to work, but keep it close to continue supplying some, if not all, oxygen to the trach. Then remove the split gauze from under the trach, even if it does not appear soiled. If you try to replace the ties with the gauze in place, the Velcro can latch onto the gauze and cause more trouble than simply replacing the gauze. Gently pull the gauze down, one side at a time. When the gauze is free, inspect it for drainage. Contact the respiratory therapist or physician if the amount or color of drainage seems like a cause for concern. Before the ties are disconnected, make sure pressure is being applied to both sides of the flange to hold the trach in place. Then, remove the ties from one side of the flange and insert the new ties in their place. Insert the ties from the back of the flange with the Velcro facing out. Because the flange is pliable, it may be helpful to lightly bend the edge up to access the back and insert the tie. But do not remove the finger from that side of the flange, or you may accidentally dislodge the trach. Pull the Velcro end back and attach it to the trach tie. Feed both the old and new trach ties behind the patient's neck to pass them to the assistant on the other side of the bed. Trade roles. The first team member will now apply pressure, while the second removes the old ties and inserts the new. Tighten the trach ties before applying the Velcro. Ideal tightness will allow you to fit 2 fingers between the tie and the patient's neck. You may need to adjust both sides to achieve this. Do not over-tighten the ties, as this can lead to pressure injury as the trach is pulled against the neck, or it could obstruct circulation to the brain. Do not under-tighten the ties, as this can lead to accidental decannulation of the trach. Proper tightness is very important. With the ties in place, replace the split gauze. Open a new pack of gauze. Always apply split gauze so that the opening is under the patient's chin. This means starting below the trach and sliding it up, never starting above and pulling the gauze down. Gently slide the gauze under the trach and trach ties. You will need to apply light pressure to the patient's neck in order to fit the gauze under the trach ties, so inform your patient beforehand. When the gauze has been pulled through, carefully move it under the flange to cover one side of the stoma. Then repeat for the opposite side. When you are finished, gauze should be under both sides of the flange, and also make sure that it has moved high enough that the gauze is under the bottom of the flange. If the slit is still visible below the flange, pull the gauze higher up on the neck. With new gauze in place, tighten the trach collar. The procedure is complete. Chart your intervention in Epic. Replacing trach ties is a process that can be completed by the nurse or respiratory therapist. But because the replacement is based on regular assessment of the patient, it is very likely that the nurse will be the one to most often identify the need for new trach ties. To keep our patients safe from developing complications, replace trach ties as often as necessary.